Hi, everybody. Good morning. Happy Monday. Welcome back after winter break. Um, it's good to get a chance to talk to all of you guys and catch up. If you didn't check your emails yet, I sent you an email just kind of giving you a little bit of an update on my life over winter break and opening room for a conversation there. And also just kind of let you know what will be going on this week. I am here today with my mom, Amy Hemstad. We will be doing a presentation on COVID. And the target for you guys today is to be able to identify the various risks associated with COVID. Tomorrow, we'll be doing a video on vaccines, so stay tuned for that. I'll pass it over to my mom, Amy Hemstad.
Thank you, Mr. Hemstead. It's really a pleasure to speak with you and your students today. It's just a real pleasure, so thank you. Just to let your students know a little bit about me, I am a registered nurse. I've been working in the field of nursing for about 40 years. I also have a graduate degree in public health. And why that matters today with my conversation with you guys is that we're going to be talking about the coronavirus. And that has become and is an important public health issue, both in terms of how the disease is being transmitted in the population, both in the United States and abroad, and how people are dealing with it. And the last thing I want to share with you is that I am a nurse educator for my job. And that means I teach healthcare professionals. And I do that for a company called AstraZeneca. And AstraZeneca is one of the companies making the vaccine, one of the many vaccines for the coronavirus. So that's a little bit about me, and I'll turn it back to you, Christopher.
Sounds good. So folks, how this will be working today is you guys submitted some questions via the Google Classroom page, and we'll be taking some time to answer those questions. So without further ado, let's dive in. Okay. So our first question, and I've kind of given it a preface question as well, is from Terrence. So I'm asking, what are some common symptoms of COVID? And Terrence Moore is asking, does COVID have any specific symptoms that some people just, it's not as common for them?
Sure, that's an excellent question. So people who develop COVID-19 can have a wide range of symptoms, and it can be everything from no symptoms at all to mild symptoms to more severe symptoms. And these symptoms will typically appear anywhere from about 2 to 14 days after somebody's been exposed to the virus. People with symptoms of COVID-19, they can be fairly general, things like some fever or chilling, or being more tired than usual, a runny nose, some difficulty breathing. So all of those things, you can imagine, students are typical of a lot of diseases. They're kind of what we call general. They're hard to pin something really specific down. So generally, when patients are experiencing these symptoms, it's recommended that they go to their physician and get checked out. One symptom that can be specific to coronavirus is the losing of your taste or smell. So if you're tasting those holiday foods that you just had and they don't taste at all like you remember them tasting, or things smell differently or don't smell, that can be something, again, to bring to your doctor's attention. So as I said, people can have no symptoms, as well as mild to severe. And the reason that they have put physical distancing measures into place is because of that. If we don't know if a person is symptomatic and feeling ill, then it's important that we maintain that distance from each other. The recommendation is at least 6 feet. Do things like wearing masks, staying away from crowds. Those type of precautions have been put in place.
Yeah. So I want to kind of spin Terrence's question back at you guys, and ask you guys, what do you think? And we'll be doing this for every single question. So we'll ask a question, we'll spend some time answering the question, then I'll ask you guys to reflect on that question. So what do you think are some symptoms that people with COVID can have? You can choose all that apply. If you're not sure what the correct answer is, feel free to just rewind the video a minute and check it. Cool. Alrighty. So without further ado, let's move on to our next question. This is from Dreana Kendrick. Dreana is wondering, how long can you have COVID?
Again, great question, Driana. So how long that you have COVID depends upon the severity of the illness. If you have something that's very mild and you don't feel very sick, people often recover within 2 weeks, sometimes less. But for more severe cases, it can take longer, up to 6 weeks to recover. And again, the most severe patients have to be hospitalized.
Yeah. And I think it really depends on just like the likelihood that, how you're reacting to COVID, and do you have any pre-existing health conditions and things like that. So, if you're somebody who has trouble with your lungs or something like that, or you have a prior condition, maybe with your heart or something, then it could take a longer time to recover from COVID, or maybe you don't recover from COVID. So what do you guys think? How long can people have COVID for? All right. We're going to move on to our next question. I kind of combined two students' questions together because they're kind of the flip-flop of each other. So Gaoli Vang is wondering, do people die easily from COVID-19? And on the opposite side of the spectrum, Steven Stibbins is wondering how likely it is for someone to survive when they've gotten COVID.
And again, as we were talking about, the answer to that question varies, right? It's so ubiquitous, and that's a big word. But there's a lot of answers to that. Generally speaking, because we know that people can have mild to more severe symptoms, we also know that, as Mr. Hemstad just said, that depending upon your age, how old you are, that can really affect how you progress and deal with the illness. And as Mr. Hemstad also said, in terms of if you have underlying issues, so you've got heart problems, you have lung problems, you have diabetes, any of those things can make it more difficult or more challenging for you to get through the illness. That being said, most people will survive and do just fine. I think the thing that I want to stress here, because I'm talking to a group of students, is that people in your age range, the chances of you getting very ill or dying from this illness are very, very, very low. And so we know that children ages 9 and under, the chances like 16 in a million. I mean, think about a million grains of sand and 16 grains of sand. I mean, it's so low. On the flip side of that, for older people, for people who are age 80 or over, the chance of getting dying from COVID is more like 78,000 in a million. So you guys are at much less risk. I'm at more risk, and grandparents are at even more risk.
And people of varying ages are somewhere in between these spectrums, right? So like Mr. Hemstead, honestly, I'm still pretty young. I'm a fairly low
You're
risk
pretty.
potential,
You're pretty.
but so if I'm low risk, you guys are even less than I am. Okay. So it's a tricky question to answer, but feel free to write a couple of sentences just explaining, do people die easily from COVID-19? Let us know your thoughts. All right. Joshua Lore is wondering, one question I have is, if somebody already caught COVID-19, can they catch it again?
Hey, Joshua, thanks for your question. I appreciate it. So the hope is that when you've been exposed to COVID, your body develops immunity. And that's kind of a big word, but basically what that means is you have protection inside your body so that when you see that virus again, your body can fight it and deal with it, and so that you don't become sick. So generally, the answer to can you get it again? Generally, no. However, there have been a few cases reported where people have recovered from the illness and subsequently, months later, gotten COVID again. So the important thing to remember about that is, if you would be one of those few people that do get the illness again, at that point you're able to transmit it again to others. And so that's why those social distancing measures, wearing masks, again, continue to be important.
And there's a lot of things that we don't really understand about COVID. There's a lot that we're learning about it because this is such a new or novel virus. The science is being developed as we speak. And so exactly how COVID is able to do this is something that we're still learning about. What do you guys think? So if somebody has already caught COVID-19, can they catch it again? Yes or no? Okay. All right. And I think, yep, that is the 4 questions that we're going to be covering today. So on Tuesday, there will be a second video for you guys to watch. We'll be going over another 4 questions then. If you want to work ahead, you're certainly welcome to. Can't wait to see you guys on Wednesday. Have a wonderful day. Bye.